Oral cancer, also known as mouth cancer, describes different tumours which affect different parts of the mouth. Tumours may arise in the tongue, the floor of mouth, the lining of the cheeks, the roof of the mouth, the soft palate, as well as the lips. Tumours may also arise in glands producing saliva. These include the parotid glands on the sides of the face. These extend into the neck, as well as the submandibular glands and sublingual glands. Mouth cancers may present in different ways, as either lumps or ulcers. Overall, if an area is present in the mouth and hasn't healed after a period of 2 weeks, these ought to be examined more closely. One of the most important causes of cancer of the mouth is smoking. Smoking and tobacco use in its various forms are strongly associated with cancers of the mouth. And these include using cigars and tobacco in the form of betel nut or areca nuts. There is no safe quantity in terms of cigarette smoking, and the evidence for using e-cigarettes has not yet been proven. Alcohol is also strongly associated with developing mouth cancer, and in particular, smoking and alcohol have an almost doubling effect, increasing the risk greater than the general population. Recently, studies have demonstrated an association of human papillomavirus with cancers of the throat in particular. HPV is a virus that is known to cause genital warts. There is much interest in this area in relation to prognosis and improvement of outcomes. The symptoms of mouth cancer are variable. In particular, if you develop an ulcer which fails to heal after a period of 2 weeks, this ought to be investigated more closely. Lumps which develop in the mouth without a reasonable explanation, which don't disappear again after 2 weeks, should be investigated further. Persistent lumps in the neck, these may be painful or painless, which do not disappear after a period of 2 to 3 weeks, should also be examined carefully. If your teeth become loose without an obvious cause, or if you've had a tooth extracted recently by your dentist and the socket has failed to heal, these may be signs which warrant further investigation for mouth cancer. If you are a denture wearer and you found that your dentures are now ill-fitting, it's important to have a specialist examine the areas under the denture for a potential cause. Any numbness that you experience in the face, for example in the lower lip or upper face under the eye, also needs to be examined carefully. You may notice red or white patches inside the mouth. The majority of these are potentially cancerous, and these can be excluded with some very simple investigations. If you find that your speech has changed and you are lisping, for example, this may well be a sign that warrants further investigation by a specialist. Approximately 7,000 people are diagnosed with mouth cancer every year in the United Kingdom. This represents approximately 2% of all cancers diagnosed. These cancers are more common in the older age group, age 50 to 74, and about 1 in 8 individuals under 50 years old will be diagnosed with mouth cancer. This group of individuals are thought to have HPV-associated mouth cancer. Overall, men are more commonly diagnosed with mouth cancer than women, and this is thought to be due to the fact that men consume more alcohol than women. Probably the most important thing you could do is not to smoke cigarettes or utilize tobacco in any of its various forms. It's also important to consume less than 14 units of alcohol per week, and that alcohol should be spread out over the week rather than being concentrated over the weekend. A healthy, balanced Mediterranean-style diet is helpful, and this needs to be rich, particularly in tomatoes, citrus fruits, and vegetables, as well as olive oils and fish. Regular checkups with your dentist are also important, as your dentist is trained in spotting the early signs of mouth cancer. The first step in diagnosing mouth cancer is to obtain a biopsy. A small sample of tissue is taken and examined under the microscope. This will confirm the diagnosis and the cancer type. We use a variety of imaging to help understand whether the cancer has spread to other parts of the body, in particularly to the neck or chest. A combination of ultrasound scans with or without a needle test to obtain fluid from a lump in the neck, for example, a CT scan or MRI scanning may be used. Occasionally, advanced imaging such as PET-CT scanning will also be required. Once all the investigations are completed, your cancer will be staged. This occurs in a multidisciplinary team meeting with a variety of cancer specialists, including radiotherapists and other surgical specialities. From this point onwards, you will have a treatment plan prior to proceeding to surgery in most cases.